Welcome to Medicine Handy Point. Today we are continuing on our urine test interpretation. This is part 6 of the video series in which we are interpreting urine tests. So let's begin. So today we will discuss ketonuria and glycosuria. Ketonuria is basically the presence of ketone in the urine, and glycosuria is the presence of glucose in the urine. Normally ketone and glucose are not present in the urine. So if the urine RE shows that there is ketonuria, it could be uncontrolled diabetes, starvation or fasting, carbohydrate free diet, or it could be SGL2 inhibitor. They can cause ketonuria. On the other hand, if there is glucose in the urine RE, so in that case it could be diabetes, most likely uncontrolled, and SGL2 inhibitor, because SGL2 receptor acts on the kidneys and prevent the absorption of the glucose. I hope you like the video. Thank you for watching.